People ask me to do this video, so I'll go ahead and try it. My best knowledge to tell you guys about this topic. So the question is how the pharmaceutical company or a store effectively build out their brand and getting the trust from their patient. Well, the important thing is if you're just looking at the store, the pharmaceutical store, the owner should have some basic knowledge of understand the regulation, knowing how to do the patient care, clinical service, community engagement, and also some financial planning. That's important. Understand the contract between the insurance and understand the supplier partnership. All those things are important, especially licensing issue. But then if you're looking at the broader sense of, how to effectively building this sort of pharmaceutical store and gaining patients' trust, you have to look at so many different perspectives. There are hospital regulation, there are medication, there are multiple like payroll authorization. Sometimes they are, psychiatrists and also the pharmaceutical company. They may not able to work well with each other if this is not the non-profit. I'm talking about in the profit sense, like a private pharmaceutical store. So there may be some like higher facility fee, and you also have to make sure that it's clinically approved, right? So in order to have this pharmaceutical store, they have to looking at the FDA 505(b)(2), the way to kind of introduce the new dosage and without repetitive for clinical trial, because every time when they do the medical clinical trial on certain site medication, it will take a long time to process. And then that's why the FDA 505(b)(2) is a pathway. Once they get approved by those things, they don't have to go through the repeating trial on medication, and the patient can get those medication as quickly as possible. So definitely a person who have this vision of opening the pharmaceutical store develop trust with the patient and other marketing hospital people, or doesn't matter which side. As long as it's relating to their pharmaceutical business, they need to understand the strategic entry point. A lot of time there are cross market moving from different places, and you have to able to offer the quality of a home administration specific on certain pharmaceutical company. You also need to have a lot of like professional nurses that will be able to administrate it about the medication, be able to answer those questions. So that's why this is very important to understand not just the some fundamental things, but you also need to have the understand those regulation consideration, and you may need to have some background in how to run like a bigger pharmaceutical company, even like knowing some hospital knowledge. Last thing is about the drug life cycle, because sometimes some drug life, their length of the duration of the cycle could be different. So that's something that need to take into consideration.